Hi, and welcome back. I'm Dr. Carrie Limberakis,
And I'm Dr. Jonathan Limberakis.
and we want to welcome you back. It's been a long time. So, during these last couple of months or so, things have changed, and they've changed here as well. We've upgraded our protocols, particularly when you arrive and throughout the office, you'll see. But when you do arrive, we ask you that you call us from your car phone. Let us know that you're here. We will need to ask you some questions and then advise you when the appropriate time to come in. We don't want too many people in the waiting room. Matter of fact, we're setting the limit at 3. That way we can be socially distancing at 6 feet apart. Once that's done, and we take your temperature as well, and when we're ready to bring you back, we will do so expeditiously and we'll commence treatment.
When you come in, we ask that you do a few things. Anytime you're in the office and not sitting in our practice chairs, we're asking that you please wear a mask. As you enter, we also ask that you either wash your hands in the bathroom, which are located just to the left of our entrance, or use hand sanitizer. When you come in, we'll not only be reviewing the questions again with you, but we'll also be taking your temperature. If you have a temperature over 100.3, the CDC states that your appointment should be rescheduled for 14 days. But we ask you that if you're not feeling well in the first place, maybe think about not scheduling the appointment. If you are having issues and aren't feeling well, please let us know because we do have the ability to make teledentistry appointments with you. As you enter, you'll also notice a couple different things about the waiting room and the office in general. We've installed some custom shields for our front desk, which is really for the comfort and the safety of our administrators. We also think they look pretty nice too. In the waiting room, you'll also see air filtration units by Menify Air, which are medical grade air filtration units which help to refresh, clean, and sterilize the air within the office roughly every 6 minutes. They're quiet and clean, and I think you'll really like the look of them as well. Throughout our tour, we're going to show you different things that we're doing in the office, but we want to let you know that our goals are to make sure that we're the safest office in the area. In addition to calling in from your phone, later on we'll have some software that will allow you to text in to our office and also share when you're available so there's less calling. Follow along and we'll show you a few more things about the office.
And one more. So the next thing I'd like to talk to you about is something called an air scrubber. What is an air scrubber? No, it's not Dick Van Dyke in the HVAC system cleaning with a broom. It's advanced technology utilizing ultraviolet light and an oxidation photocatalyst system that decontaminates and purifies the air. So when you look up and you see our air ventilation system, know that the air is being purified and cleaned multiple times in an hour so that you have the cleanest air. In addition, what was I going to say?
Something about NASA, I think.
That's what it was. I wanted to let you know that we actually took the lead from NASA and their International Space Station. Yeah, they use air scrubbers. So normally we lead and they get the idea from us, but this time it's the other way around.
Just so happens.
What are you gonna do?
And there are multiple of those air scrubbers within our HVAC units. So again, those aren't something you'll be able to see, but they're going to be working behind the scenes as an extra layer of protection. As I mentioned, in the waiting room where we'll have different medical grade air filtration units, we'll also have one in each operatory. So approximately every 6 minutes, again, the air will be filtered out. We have enough air filtration units in our office to cover well over 4,000 square feet of office space, and we're much smaller than that. So know that when you're breathing in the air, it's going to be clean and scrubbed and filtered, down to the 0.1 micron, which is smaller than a COVID particle. The other thing that we'll be doing is we'll have our office maintenance come in even more frequently, and they're going to be increasing the potency of the formulas they'll be using to clean the office and the office surfaces. I believe you mentioned the air scrubbers also are able to disinfect surfaces as well, which is
Right.
pretty fantastic.
Right.
Finally, as another layer of protection, we're also going to be bringing in a antiviral fogging unit to clean the office. It's not only safe, but it's effective, and within 1 minute, it's able to kill 99.997% of any viral particles on any surface within the office. So there are many layers of protection here at work.
The next thing that we want to talk about is the concept of aerosols. Aerosols occur when you breathe and when we do dental procedures, whether they are cleanings by the hygienist or tooth preparations by the dentist.
Like fillings and crowns.
Exactly. And aerosols are produced, but we want to minimize them as much as possible. So how do we do that? Well, the hygienist will be using something called a relief, which is a high-speed evacuation system. See, there's 2 leaves right there. Relief.
Single use, disposable after every patient.
The dentist and the assistant will be using dry shields in addition to the high-speed evacuation. This has been shown, evidence-based literature has demonstrated that this is the best means of reducing aerosols. You know, I have to tell you, because I speak with conviction, having served on the ADA Council on Dental Practice for the last 3 years, another year to go on my term, I am very familiar with the latest scientific evidence-based information to minimize aerosols. And what we do here is what is recommended by the ADA, American Dental Association. So I speak with conviction.
You're also probably wondering, are we safe? And that's a great question. So just like every patient will be required to have their temperature taken and be screened prior to entering the office, we're going to do the very same thing. Every day, every staff member will be required to have their temperature taken and make sure that we're healthy and feeling safe. Pretty hot.
And speaking of hot, with our masks, with our eye protection, with our face shields, and our gloves, we add multiple layers of protection for us and for you.
But it does get pretty hot. We want you to know that we have thoroughly reviewed all of the CDC, OSHA, and American Dental Association guidelines for all the changes that have taken place to keep our offices safe. We are well on top of everything that's changed, and also we haven't rushed to reopen until we made sure all of our protocols and safety measures were in place. We would not want to bring you back to the office if we did not feel it was safe to do so. We're happy to see you and treat you as safely as possible, and we want you to feel confident about coming back into the office for your necessary work for your dental and overall health.
We look forward to wholeheartedly welcoming you back, and we can't wait to see your smiles.
Take care and see you soon.
Thank you.